Hey, thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi. An FDA advisory committee voted on Tuesday that phenylephrine isn't effective as a decongestant. Now, I just said a bunch of big words, but I'm going to kind of clarify this and why this is significant. For starters, phenylephrine, that is a common ingredient in cold medicines, and it might mean that it could be removed from store shelves. That could mean things like Tylenol, as well as Dayquil, things like that could be removed from store shelves in the coming weeks. And joining us from a bit more about this potentially significant development is Letitia Shea from Regis University, and we appreciate you joining us and giving us a bit of insight about this potentially significant development. I suppose, Letitia, before you get into anything else, for starters, did I get that overview right? And two, do you think that this will ultimately lead to a lot of those common cold medicines being removed from store shelves?
There are a lot of cough and cold medications that have phenylephrine in them. So if it's decided upon that it is going to be removed, it's likely there will be a lot of medications that are pulled from the market, especially really popular ones like Dayquil.
Okay. So to be clear, it's that phenylephrine is ineffective, right? Not that it's dangerous, but it's just that it's basically a placebo. Is that it?
Well, yes, that's predominantly what they found, is that at the dosing available of 10 milligrams of phenylephrine, that's usually what the dose is or below that in combination products, that it has not really shown to be more effective than placebo in some trials.
Okay. And phenylephrine is commonly found in cold medicines. I mentioned Tylenol, Dayquil. What are some other ones, and would, again, this potentially lead to those being removed from store shelves?
I think it would, if that's what they decide to do. Oral phenylephrine is a decongestant, and so it's used to help with congestion of the nasal mucosa. And so if any products that, provide aid with, maybe if it says sinus pressure or sinus aid, it might have phenylephrine inside it. Most of them have combinations. Phenylephrine and acetaminophen are usually, you said Tylenol, which is a brand name for acetaminophen, and phenylephrine is usually combined with acetaminophen and maybe some other cough products such as dextromethorphan. In general, it's in combination products, and so it used to be Sudafed that was found in these combination products, but when they made Sudafed go behind the counter, where you would need a driver's license to obtain it because it was associated with the making of methamphetamine, they replaced that ingredient in these combination products with phenylephrine. So unless they find another product, I think a lot of them are not going to have phenylephrine available.
What does that mean? So, for example, these common cold medicines, does that mean over the years that they've been essentially placebos or kind of not particularly helpful in decongestants? Or are there other products within some of those medicines, like Tylenol, like Dayquil, for example, that are effective at reducing congestion?
No, the only thing that's effective for reducing congestion over the counter, it depends too. I think when you say congestion, it's important us to think about what is causing the congestion. So if we have congestion that's caused based on allergy symptoms or allergy mediators, then you might have a response from Flonase or fluticasone or an intranasal steroid. But if it's just a cold symptom, it's a cold caused congestion, then you need a decongestant. And Sudafed, which is behind the counter, is an effective decongestant to help with congestion, as well as intranasal decongestants like oxymetazoline. That one will still be available, but it's intranasal. It's not. So the issue that we're having is with oral products. And so oral products that have phenylephrine, are they effective? Likely not. At least that's what the studies show. But, placebo is super strong, and there's other ingredients in them that might provide some benefit. Acetaminophen for pain relief.
Okay.
Dextromethorphan to help with cough, although it's really not that effective. Especially in combination, most of the combination products are subtherapeutic. So rather than getting a full dose of things, you're getting a smaller dose, but with a combination of other products.
So those things aren't entirely worthless. There's other benefits to them. It's just that maybe the behind-the-counter ones, at least the way things are right now. Again, you mentioned Sudafed, which you can't get over the counter anymore because of the possible links to methamphetamine, as you mentioned. But it's the over-the-counter ones right now that have other uses to them besides decongestion.
little bit. But really, the studies aren't there. We're focusing on phenylephrine right now because really it's been known to be pretty close to placebo since I think a lot of studies came out in 2007. And they came out in 2007 because that was when Sudafed had to go behind the counter. And so these combination products had to come up with a decongestant. And phenylephrine was around since the 1970s, I think 1974 it was approved. But
so 50 years.
It's been around for a long time, just not that effective. So it was Sudafed that was in those products. But when Sudafed had to go behind the counter, they had another product that was available.
2007 is a long time. So it's been 16 years. How come these medicines have been able to be sold for, gosh knows, millions, probably billions of dollars in that time frame?
I know. I don't know. We've known it. I think you said something in the beginning. We don't know about efficacy, but generally we're thinking in the adult population, we're not finding too much harm associated with it. Although there is harm with decongestants that are used in certain populations. It increases, it's a sympathomimetic, which means it stimulates your sympathetic nervous system, which is, in other words, your fight or flight. And so for individuals with high blood pressure or cardiovascular risk, we really don't want them taking oral decongestants anyhow. We want to increase their blood pressure. And so there's certain populations that a decongestant is never safe in, regardless. But in the general population, I think 10 milligrams or less of phenylephrine, generally well tolerated. Efficacious? Probably not. But tolerated, sure.
Okay, so maybe with all this in mind, some possible solutions, so to speak. So let's say you do have a runny nose. And I know you mentioned it depends on whether we're talking about allergy, whether we're talking about a common cold, or other factors behind it. What would you generally recommend for somebody if they have a runny nose?
I think the best thing you can do if you have a runny nose and you're feeling crummy is intranasal saline, which I know is like, it's awkward. You got to pour something on one, clean out your nostril. But it's actually been shown to be fairly effective, and it decreases the length of time a patient is sick, as well as minimizes their symptoms. It's also been shown to reduce the need for medication, which is always a benefit. So something safe. A little bit awkward, but I think intranasal saline is a great way to go. If you're really miserable with congestion, now congestion is more of just a runny nose. It's where it's that nasal mucosa is it feels full, but you can't do much about it. Intranasal saline or intranasal. What are they called? Intranasal decongestants, such as oxymetazoline, still effective for doing that, but you have to be careful not to overuse those because then you get rebound congestion.
Okay. So generally the tube up the nose is the best way to do it.
The saline irrigation, the neti pot, although I haven't seen neti pot for a while, but a lot of times it's the saline rinse that comes like in a squeeze bottle, and you squeeze through one nostril, clear it out, use the other nostril. Just make sure you use clean water, distilled water, or water that's boiled first, because we don't want to introduce any microbes.
If we had to go to medication, let's say people don't want to do that, and we're recording this here in September, let's say we're heading into winter, what are possible options? You mentioned Sudafed. Is that something you recommend?
Sudafed is effective. It's been shown to be an effective decongestant, oral decongestant. So yes, you just need your driver's license, go to the pharmacy, and get some Sudafed. But another beneficial thing about that is you're only taking one product, not a combination of products, likely for things that you're not experiencing. The cold has, a variation of symptoms throughout its course, and generally you're having, in the beginning, sometimes it's a sore throat, and pain, discomfort. You take Tylenol or ibuprofen if appropriate in the beginning, but then when you get the congestion or the runny nose, then you can take Sudafed for that, but you don't have so much of that sore throat symptom anymore. So rather than taking drugs that you don't need, you focus on the symptom presenting. So during that time when you have congestion, you can take oral decongestant as long as you don't have high blood pressure or cardiovascular risk.
So obviously know that first and foremost.
Yeah.
Any final things we should know about phenylephrine and its possible removal here from the market, and what people should do when they're decongested at this point, or congested at this point?
Yeah, I think, if you have congestion, evaluate why do I have congestion. Is it because I have allergies, or is it because I have a cold? If I have a cold, it's going to be for, a week of time of misery. So is a decongestant appropriate for you? If so, then Sudafed's available just behind the counter. If it isn't available, or if it's not appropriate for you, saline saline rinse is a great option. If it's allergy mediated, Flonase is great, intranasal steroids, as well as over the counter just recently, intranasal antihistamine, Astapro, is helpful for congestion associated with allergy mediated symptoms. If it is just a cold, you've got your saline rinse, you've got intranasal decongestants such as oxymetazoline, and I'd recommend that one because it's a 12-hour, and so that way you do it once, try not to use it more than for 3 days so you don't get rebound congestion.
Okay, so there are alternatives out there.
Totally.
And so we're prepared in the event that a lot of those over-the-counter medications like Tylenol, like, again, Dayquil are removed. So that's good news, right?
Yeah, there's plenty of options.
All right. Well, we appreciate Latisha Shea from Regis University. Appreciate a few minutes of your time here on 9 News Plus.
I'm excited to be here. Thank you.
Thanks for having us.